And we stay on health matters. Cancer cases will increase by 60% worldwide if countries don't work to improve prevention, diagnosis and treatment. That's according to the World Health Organization, which warns that low and middle income countries where the limited resources for cancer, like South Africa, could see an 81% increase in cases over the next 2 decades. We are now joined by Ouma Mamatela, who is from the Breast Health Foundation, and she's joining us now in studio. Good evening and welcome to The Full View. Where are we losing this battle?
Currently, I must say we are doing our best, but at the moment, mainly the patients who are doing radiation are back in 3 months because the machines at Charlotte Maxeke were broken. So now the problem has been fixed, but you can understand if it has been fixed, it means it is going 3 months back. So the patients are being delayed at the moment, but they certainly have assured that they are working on it.
But this particular problem, when it comes to the oncology wards especially, we've seen reports last year as well in Durban, in KZN, where the entire province was struggling with this. Where is it that it seems as though that, for instance, at a national level, that all the resources that are needed to deal with cancer are not being deployed?
I think that the government must be in negotiations with the NGOs, because if you are speaking to the NGOs, you are speaking to the patient themselves. Then by speaking to the NGOs, they will be able to get information that patients are struggling to get the treatment. So that it's done, but it's not up to the level where the patient can raise their concerns that they're not getting the full treatment. But I must say at the moment it is getting there. It is getting there.
So where is this lack of communication? Where does it come from? Is it a provincial issue? Is it a national issue? Because there has been another debate when it comes to the Department of Education as well as the Department of Health, that there seems to be a lack of cohesiveness when it comes to what is being implemented at a national level in terms of policy or what should be implemented, and then you trickle it down to the provincial level, and you'd find that it would seem as though that the MECs are not engaging, as well as the head of departments are not engaging with the NGOs, as you said earlier on.
The policy is there. It has never been implemented. We were called as NGOs to be introduced to the policy, and it has never been implemented. We don't know what the held up is at the moment, so we can't say this is the issue that is happening. But as an NGO at a lower level, we're doing our best. It's unfortunate that we can't go nationally, but provincially we do our best to conduct our MEC, and we constantly have the meetings with them here and there.
And how's that been?
Like for at the moment, there's a progress in terms of getting treatment at Charlotte Maxeke through the meetings. Yes.
And what about, I know that you're speaking about the province quite specifically, but when you engage with other NGOs that are also in this particular field, what is it that they are telling you? Because there's a report, for instance, in the Mail and Guardian today, speaking about the story of Kanyeleni, who died at the age of 30 just a few days ago. And the issue there was that the entire province is being served by one oncologist.
When we talk about Gauteng province, it's Charlotte Maxeke and Steve Biko. So that's our oncologist. Yes, they are overcrowded, but they are doing their best to service the whole community. You find that, let's for instance say the patients who are staying afar. Like in the Val, for instance, traveling all the way to the Charlotte Maxeke, it's another thing. So it's a struggle again for patients. If again what we are asking, that can we have this breast centers or the cancer centers near the communities so that people can have access?
Be mobile?
Yes. Yes.
And what's the attitude around that?
Some of the NGO are against that. but it can be done if it's done the correct way.
The reason that I'm asking this particular question as well is that if you look at the WHO's Assistant Director General, Ren, who spoke about in this report that there needs to be a wake-up call for us all to tackle the unacceptable inequalities between cancer services in rich and poor countries. And we can speak about this and speak about rich and poor communities in the case of South Africa.
Yes, like for instance, when you are poor, waiting period to get the treatment, it's a bit long. Okay, you get into the clinic today, you get a referral to get to be diagnosed. It takes a while, and for you after the diagnosis to get the treatment, it takes a while. But at Helen Joseph, the whole process will take you about 2 weeks, and it's a public hospital. So in other centers, it's not being implemented as yet. Okay, it takes a while. By the time the patients get treatment, they are already in later stages, and some don't even make it.
Let's just quickly touch on early detection. Is it possible at all to get companies involved and encourage companies to encourage their employees to, go for these tests?
Currently, we've partnered with Discovery. They are helping us to get the patient from Hlokomela. Hlokomela is actually in Limpopo because those patients there, they didn't have access at all to treatment. So we pick them up from Hlokomela, bring them here at Helen Joseph for them to get the treatment. So Discovery is actually sponsors that for that. So we are very grateful for that. So patients are getting treatment.
What is the type of cancer that's more prevalent here in the country?
Breast cancer.
Certainly.
Breast cancer. Most women are ignorant of it, and it's a silent killer, and it's the most popular cancer at the moment.
And in this report as well, they highlight, for instance, when it comes to cervical cancer, how it affects women, especially on the southern hemisphere.
Yes.
Why is that the case?
To be honest, it's not yet proven why is the case, but women in southern hemisphere are affected at the moment, and by the time they also get treatment, because there is a lack of information, by the time they get treatment, some don't make it. For those who make it, immediately after that they go into depression, and it's not an easy journey.
Okay, thank you so much for your time. Appreciate your time. That was Ouma Mamatela from the Breast Health Foundation.